All right, let's do a 20-minute anatomy terminology quiz. Question 1. Which of the following means the same thing as anterior? Is it ventral, caudal, superior, inferior? Anterior means in the front, so we are going to go with ventral, and it is correct. Ventral, also called anterior, refers to the front. Posterior, also called dorsal, refers to the back. Inferior, also called caudal, refers to below. And superior, also called cranial, refers to above. Next question. Which of the following terms refers to behind or towards the back? Is it superior, ventral, anterior, or dorsal? Towards the back. Let's see. Dorsal. Dorsal, also called posterior, means back. In contrast, anterior means front or closer to the front. Ventral is another term for toward the front. Superior means above. Next question. Which of the following suggests a location toward the head? Is it posterior, caudal, superior, or inferior? Superior. Superior means above or closer to the head. Inferior means lower or further from the head. Caudal also means lower or further from the head. Posterior means behind. Next question. Which of the following refers to the term distal? Away from the midline, closer to the trunk or point of attachment, towards the midline, farther from the trunk or point of attachment. Let's see. Distal is farther from the trunk or point of attachment. Distal refers to being farther from the trunk or the point of attachment. Proximal refers to being closer to the trunk or point of attachment. Lateral refers to being further away from the midline. All right, next question. Which of the following best describes the location of the chest? Is it posterior to the vertebral column, anterior to the vertebral column, superior to the vertebral column, I can't speak right now, and inferior to the vertebral column? So, which of the following best describes the location of the chest? Is it posterior to the vertebral column? I think that might be it. Let's see. No, it's anterior to the vertebral column. So, the chest is in front of the vertebral column. The chest is in front of the vertebral column. Also, which of the following best describes the location of the chest? The chest is in front of the vertebral column. So, we would say the chest is anterior. I don't know why I put posterior. You got them mixed up. The chest is not posterior to the vertebral column. That would indicate the chest is behind the vertebral column. The chest is not superior to the vertebral column or inferior. Okay, next question. Which plane divides the body into left and right sides? Is it coronal, frontal, sagittal, or transverse? Sagittal. The sagittal plane is a vertical plane that runs from the front to the back, dividing the body into left and right. The coronal plane, also called the frontal plane, is a vertical plane that divides the body into front anterior and back posterior sections. The transverse plane is a horizontal plane that divides the body into upper, superior, and lower inferior parts. Next question. Which parts are produced when the body is cut through the transverse plane? Is it anterior and posterior, left and right, ventral and dorsal, or superior and inferior? It's going to be superior or inferior because a transverse plane is a horizontal plane that divides the body into upper, superior, and lower inferior parts. Next question. Which of the following is incorrect regarding anatomical position? Incorrect. Keyword. The person is standing upright, gazing at the feet, which are planted flat, parallel, and facing forward. So we know that they're not gazing at the feet. So That is the incorrect choice. The person is standing upright, gazing at the feet, which are planted flat. This is correct because it is incorrectly describing the anatomical position. The anatomical position is described as a person standing upright, facing the observer, gazing forward, with feet flat, parallel, and pointing forward. Which of the following is found in the head region? Is it the adrenal gland, pituitary gland, pancreas, or prostate? Oh, hi Lumos. This is the pituitary gland. The pituitary gland is an endocrine gland found at the base of the brain. It is regarded as the master gland because it regulates activities of other glands like the thyroid gland and the adrenal gland. It also regulates activities of sex organs. The adrenal glands are found on the kidneys. They produce cortisol, aldosterone, adrenaline, and small quantities of the male hormones like testosterone. The pancreas is located in the abdomen. It produces digestive enzymes and insulin, so it functions both as an exocrine and endocrine gland. Pancreas. The prostate is found in the pelvic region. It is part of the male reproductive system. It produces fluids that combine with sperm cells and from the testes and other fluids to form sperm. Next question. Which of the following is not found in the neck? Is it the thyroid gland, larynx, hypothalamus, and the trachea? Which is not found in the neck? Not in the neck. I'm going to go with hypothalamus, and that is correct. The hypothalamus is located in the head region. The larynx is the voice box. The trachea connects to the larynx, and the thyroid gland is an endocrine gland that produces thyroid hormone that regulates metabolic rates of the body cells. In which region can the popliteal fossa be found? Is it head region, neck region, lower extremities, upper extremities? Let's see, we're going to go with lower extremities. Fossa in anatomy refers to the small dent or cavity in a bone. The popliteal region of the body refers to the back of the knee. Therefore, the popliteal fossa is a small cavity found at the back of the knee joint. It contains the popliteal vessels, the tibial nerve, and the common fibular nerve. Conversely, the cubital fossa, also known as antecubital fossa, is the cavity located in front of the elbow joint. All right, next question. Which cavity contains the ovaries? Abdominal cavity, thoracic cavity, dorsal cavity, pelvic cavity. We're going to go with pelvic cavity. The pelvic cavity contains the bladder, urethra, rectum, and genital organs. The thoracic cavity contains the trachea, bronchi, lungs, heart, aorta, superior and inferior vena cava, pulmonary artery, veins, thymus, and thoracic duct. The abdominal cavity contains liver, gallbladder, spleen, kidneys, ureters, adrenal glands, pancreas, small and large intestines, and the stomach. And the dorsal cavity contains the brain and the spinal cord. Next question. Which of the following is not present in the abdominal cavity? Abdominal cavity. Which is not present in the abdominal cavity? Stomach, liver, spleen, rectum. We're going to go with rectum. The rectum is a chamber at the end of the large intestine toward the end of the digestive system. It is found in the pelvic cavity. The abdominal cavity is a large cavity between the thoracic cavity and the pelvic cavity. It contains the liver, gallbladder, spleen, kidneys, ureters, adrenal glands, pancreas, appendix, small and large intestines, and the stomach. Next question. Which of the following is present in the thoracic cavity? Esophagus, gallbladder, kidneys, cerebellum. Which of the following is present in the thoracic cavity? Esophagus, gallbladder, kidneys, cerebellum. Thoracic. I'm going to go with esophagus. Let's check. It's correct. The esophagus is a tube that connects the pharynx to the stomach. The esophagus is a tube that connects the pharynx to the stomach. The gallbladder is found in the abdomen. The kidneys are found in the abdominal cavity. The cerebellum is found in the cranial cavity. The thoracic cavity is a compartment enclosed by the rib cage and the sternum. All right, next question. The lungs are blank to the diaphragm. The lungs are blank to the diaphragm. So is it the lungs are anterior, superior, inferior, or proximal? I'm going to go with superior, which is correct. The diaphragm is a muscle that separates the thoracic and abdominal cavities. The lungs sit on the diaphragm, so they are superior or on top of the diaphragm. All right, next question. The tibia is blank to the femur. Is it proximal, distal, medial, lateral? I'm gonna go with distal, which is correct. In anatomical terms, distal refers to being farther from the point of attachment or the trunk of the body, whereas the femur is closer to the hip joint and the trunk, making it proximal in relation to the tibia. So proximal would indicate that the tibia is closer to the trunk than the femur, which is incorrect. All right, next question. Which of the following is the most proximal bone to the upper limb? Which of the following is the most proximal bone to the upper limb? Is it the radius, the carpus, the humerus, or the ulna? Let's see if it's the humerus. Correct. The humerus, the upper arm bone, is the closest part to the point of attachment of the upper limb, aka closest to the trunk, compared to the humerus, the radius, and the ulna and the carpus, which are away from the trunk. Next question. The lungs are blank to the heart. Are the lungs medial to the heart, inferior to the heart, lateral to the heart, or anterior to the heart? Let's see. I would say inferior. Let's check. Oh, it's lateral. Okay. The lungs are lateral to the heart. This anatomical term refers to a position that is away from the midline of the body. Lateral. I always get that confused. Lateral doesn't mean lateral. It means that it is away from the midline. Okay. In the case of the lungs, the heart is lateral from the heart. Okay. Next question. Which of the following is the most medial? Lungs, spleen, right adrenal gland, heart. We're going to go with heart because the heart is the closest to the midline. There we go. Next question. Which of the following lies anterior to the rib cage? Anterior to the rib cage. Is it the breast, lung, stomach, and small intestine? It's going to be the breast. The breasts are in front of the rib cage, so they are described as being anterior to the rib cage. All right, let's see how we did. Finish the quiz. I'm saying we, but I got a 90%. So this is amazing, guys. Let's go to the next quiz.